So this presentation is severe and enduring eating disorders. And to put this in context, we've actually found this a really challenging section to develop. And in light of this, we would really appreciate feedback from the consultation process so it can be as meaningful as possible. There is concerns that terms that have been used in this area, for example, treatment resistant, are really unhelpful and can actually lead to negative outcomes for people. And we're really clear when we write this that we feel that recovery is possible. However, we know that a third of people with anorexia and bulimia are still living with their eating disorder after more than 2 decades. So it seems really important that we look at how treatment and care is optimised in this group. There isn't an agreement or consensus in definition, and for the purposes of SIGN, we've chosen the term severe and enduring eating disorders with a duration of at least 7 years or more. We are aware that there are other definitions with additional dimensions. All can be challenging and quite problematic to define. To draw your attention to 2 studies, a recent systematic review by Cottalati showed that follow-up from inpatient trials was mixed, although people tended to do quite well whilst they were in hospital. There was more positive outcome for outpatient and day patient treatments, and improvements in eating disorder symptomatology improved over time. 2S did a really interesting RCT where he modified CBT and SSCM to enhance quality of life and also to look at harm minimisation in people with anorexia. People significantly improved across both treatments in primary outcomes of quality of life, depression and social adjustment. And actually, at end of treatment, 6-month and 12-month follow-up, they also improved in secondary outcomes of BMI, eating disorder, psychopathology, and readiness to recover. Actually, the retention rate was also really positive in this study of 87%. So I guess what this tells us is people respond to both traditional treatment approaches and to those modified for people with severe and enduring eating disorders. However, there is a dearth of clinical empirically based research to guide practice, and most of the literature is based on clinical opinion and or expert opinion, and it's strongly biased towards people with anorexia nervosa, with very little written on other eating disorder presentations. Given that there's limited response to even the most evidence-based treatments within the field of eating disorders, it does seem appropriate that people with severe and enduring eating disorders are offered more than one evidence-based treatment and any promising alternatives, and these can also be revisited over time with greater neuropsychological developmental maturity. It might be that at times it could be helpful to move from active targeting of symptoms, eating disorder symptoms, to a more holistic approach, improving quality of life and enhancing well-being whilst minimising the impact of the eating disorder. However, when and what form this takes hasn't been empirically researched, but I guess we might be looking at a fluid approach where we move in and out of treatment, potentially with reduced intensity, but with symptoms challenging treatment remaining an option. I think what's clear is that there is a need for research to look at areas of this, and in particular innovative and innovative treatments as well as existing interventions to see what might be beneficial to this group. And finally, this is the recommendations that we made. Thank you.